Hi everybody and welcome to another episode of The Anxious Resistance. Today I'm going to be talking about over-the-counter sleep medications. Now this is something that a lot of people deal with and a lot of people use these medications and they want to know what's effective, what's not, what's worth your time, what's not. So I'm going to talk about some of them and even share with you some of my experiences with some of them. So if you have trouble falling asleep or staying asleep, you might be tempted to try an over-the-counter sleep aid. These are medications that you can buy without a prescription from your doctor. They claim to help you sleep better, faster, longer, but do they really work and are they safe to use? In this video, we will review some of the most common types of over-the-counter medications for sleep, their benefits and risks, and some tips for using them safely and effectively. So what are the types of over-the-counter sleep aids? There are many different kinds of over-the-counter sleep aids available in the market. They can be divided into three main categories. These include antihistamines, melatonin, and herbal supplements. So first off, let's talk about antihistamines. Most of the time, these are used to treat allergies. That's why you may have heard of them before. Some of these you may have even used for allergies or allergic reactions. Antihistamines are drugs that block the action of histamine, a chemical that causes allergic reactions. They also have a sedating effect on the brain, which can make you feel sleepy. Some of the most popular antihistamines used as sleep aids are diphenhydramine, otherwise known by a brand name as Benadryl, and doxylamine, which is also known as Unisom. Antihistamines can help you fall asleep faster and reduce the number of awakenings during the night. However, they also have some drawbacks. They can cause side effects such as dry mouth, blurred vision, constipation, urinary retention, and drowsiness the next day. They can also lose their effectiveness over time as your body develops tolerance to them. They can also interact with other medications such as antidepressants, blood pressure drugs, and alcohol. Antihistamines are not recommended for people who have certain health conditions such as glaucoma, prostate enlargement, asthma. Antihistamines are not recommended for people who have certain health conditions such as glaucoma, prostate enlargement, asthma, or heart problems. They are also not suitable for pregnant or breastfeeding women, children under 12 years old, or older adults. Okay, category number 2, we'll talk about melatonin. Not much of a category, it's one drug. Melatonin is a hormone that regulates your circadian rhythm or your natural sleep-wake cycle. It is produced by your pineal gland in response to darkness and light. It helps you feel sleepy at night and alert during the day. So melatonin supplements are synthetic versions of the hormone that you can take orally. They are often used to treat jet lag, shift work disorder, delayed sleep phase syndrome, and other circadian rhythm disorders. They may also help people with insomnia fall asleep faster and improve their sleep quality. So melatonin is considered safe and well tolerated by most people. However, it can also cause some side effects such as headaches, nausea, dizziness, and daytime sleepiness. It can also interact with some medications such as blood thinners, anticonvulsants, and immunosuppressants. Melatonin is not regulated by the FDA as a drug, but as a dietary supplement. This means that its quality, purity, potency, and safety are not guaranteed by the manufacturer or the government. Therefore, it is important to buy melatonin from reputable sources and follow the dosage instructions carefully. Okay, category number 3, herbal supplements. Herbal supplements are products made from plants or plant extracts that claim to have medicinal properties. Some of the most common herbs used as sleep aids are valerian root, chamomile, lavender, lemon balm, passion flower, and hops. Herbal supplements may have a mild sedative effect on the nervous system and help you relax and fall asleep. However, they also have some limitations. They may not be effective for everyone or for severe cases of insomnia. They may also cause allergic reactions or interact with other medications or supplements. They may also contain contaminants or adulterants that can harm your health. Herbal supplements are also not regulated by the FDA's drugs, but as dietary supplements. This means that their quality, purity, potency, and safety, like I mentioned with melatonin, are not guaranteed by the manufacturer or the government. Therefore, you need to be careful what you buy, make sure you do your research, make sure you find good products that are independently verified. Let me give you some tips and tricks to how to use over-the-counter sleep aids safely and effectively. Before you decide to use a sleep aid, you should consult your doctor first. Your doctor can help you determine the cause of your sleep problems and recommend the best treatment options for you. Sometimes your sleep issues are treated better by something else. For example, if you had obstructive sleep apnea, central sleep apnea, any other kind of sleep disorder, restless leg syndrome, you're going to want to treat the underlying condition rather than just give you a medication that sedates you. And I mean, hopefully it would at least have some effect to help your sleep be better, but you want to treat that underlying condition instead. If you choose to use an over-the-counter sleep aid, you should follow these tips. Use it only occasionally and for short-term use, no more than 2 weeks. Do not use it every night or for long periods of time unless your doctor says it's okay. Now, your doctors know about this stuff or should know about these things and should be able to guide you if you need to use these things for more long-term use. Use it only when you have enough time to fall asleep for at least 7 to 8 hours. Okay, some of these are a bit benign. You should understand how your body reacts. Some of you know that, if you take some Benadryl for sleep, it's going to wear off in 3 or 4 hours for you. So you're probably okay if that's the case to not have to plan out for 8 hours. But you should make sure that when you take it, you have planned enough time to sleep and sleep for as long as you think the medication will last for you. Next thing you should do is make sure you use the lowest effective dose and follow the directions on the label. So you don't want to double, quadruple the dose on these things. Just don't do that unless instructed by your doctor or other healthcare provider. Don't combine them with other sleep aids, alcohol, or drugs. And this depends on the circumstance. Again, your doctor can advise you if you need to combine certain things. Most of the time, my understanding is that melatonin can be combined with most things because it's not necessarily sedating. It just helps you regulate that sleep-wake cycle. So you should avoid caffeine, nicotine, and other stimulants in the evenings because they can interfere with your sleep aid and make you more dependent on sleep aids. And last but definitely not least, practice good sleep hygiene habits. This one is hard. I know it's hard because I struggle with it all the time. I do shift work as a psych nurse. I go to work, I have to be to work at 6 a.m. means I have to be up at 5 a.m. Do I get up at 5 a.m. on the days that I don't work? No. So do I have consistent sleep? No. Do I wish I did? Yes. Am I always working on it? Yes. Am I always trying to avoid naps? Yes. Again, you guys have probably heard these things a million times. Make sure you avoid naps, keep a regular sleep schedule, make sure you have a comfortable dark environment to sleep in, make sure you have a good sleep routine, all of these things. Now, it's difficult, it's hard, I understand that, but they can go a long ways towards helping you have regular sleep, having higher quality sleep, and feeling more rested. Okay, so in conclusion, over-the-counter sleep aids can be helpful for some people who have occasional or mild insomnia. However, they are not a cure for chronic or severe sleep problems. They can also cause side effects and interactions that can affect your overall well-being. Therefore, it is important to consult your doctor before using any over-the-counter sleep aid and use it only as directed. You should also try to improve your sleep habits and lifestyle factors that can affect your sleep quality. Remember, over-the-counter sleep aids are not a substitute for a good night's sleep, so you can't just rely on these all the time if you're not doing good things to help you sleep, like having good sleep hygiene. They are a temporary solution. Many of them do lose effect over time. You may need to cycle through some of them at the direction of your doctor so that if you lose effect from one, you have another one you can use in the meantime. The best way to achieve healthy and restful sleep is to address the underlying causes of your sleep problems, whether that's depression, whether that's anxiety, maybe bipolar. Most mental health conditions will affect sleep in some way or another. Either you'll be having way too much or not enough, or low quality sleep. So you need to address whatever your overall problem is. And that's often done by a psychiatrist, by a psychologist, by a social worker who can help get you to the right resources. So thank you so much for watching this video. I hope you learned something about over-the-counter sleep aids and some things that you should do to improve your sleep quality. Thank you so much for watching and supporting. See you next time.